Hey everyone, myself Dr. Shravya, Senior Resident in Department of Radio Diagnosis at AIMS Hyderabad. Today I'll present an interesting case. A 23-year-old female patient came with complaints of abdominal pain and bleeding PV since 2 days. A UPT was done for the patient and it was positive. The case was referred to us from the Department of OBGYN for USG pelvis. On transvaginal sonography, we could see that the uterus was normal. There was no evidence of any gestational sac or thickened decidua or endometrium. There was mild free fluid in the POD. The left ovary was normal. In the right adnexa, we could visualize an ill-defined heterogeneously hyperechoic lesion measuring around 5 into 3 centimeters. The lesion was showing internal vascularity and right ovary was not separately visualized. Therefore, we gave a diagnosis of ectopic pregnancy that is likely ruptured. The patient was immediately shifted to the OT and salpingectomy was done. These are the intraop images. This is the fallopian tube and these are the debris. So coming to the discussion, ectopic pregnancy refers to the implantation of fertilized ovum outside the uterine cavity. The risk factors are in vitro fertilization, prior ectopic pregnancy, tubal injury or surgery, or any pelvic inflammatory disease, endometrial injury, or presence of any IUCDs. Coming to the location of ectopic pregnancy, the most common site is fallopian tube, and within the fallopian tube, the most common site is ampullary region, followed by isthmus, followed by fimbria, and followed by interstitial region. Then the other sites of ectopic pregnancy are ovarian ectopic, cervical ectopic, scar ectopic, or abdominal ectopic. Clinical features are usually abdominal pain and bleeding, and usually the symptoms may not be necessarily severe. Often there might be only mild pelvic pain and spotting in case of early pregnancy. So let us discuss about the findings in tubal ectopic pregnancy. In ultrasound, the uterus may be normal in size or enlarged. There might be residual reaction with pseudocyst formation. There may be pseudo-sac formation in the cavity. There may be presence of hemoperitoneum in case of a ruptured ectopic, and there may be presence of extrauterine or extra ovarian mass. There may be inhomogeneous adnexal mass, that is the blob sign, or there may be empty extrauterine gestational sac, that is the bagel sign. Coming to the management, it might be expected management or a surgical management where we do salpingostomy or salpingectomy, or there may be conservative management where we use systemic methotrexate or intrasac methotrexate. Thank you. These are my references.